Hi, today is Friday, May 8th, 2026. May 8th in Korea is the Parents' Day. All the children buy flowers or nice foods for their parents. If their parents live far away, they make a travel to their parents' home and treat them to nice food, nice drinks, and buy some gifts such as flowers, and they appreciate their existence in their lives, and they appreciate their parents giving birth to themselves. So it's becoming more big day to celebrate in Korea. Currently, I am sitting at a park bench near Songsu Station. Today is my company's picnic day, so we are going to explore Seoul Forest, then have a nice meal. We have to spend 70,000 won, about $50 for picnic. So I heard that we are going to eat a nice steak in a course. So I have high hopes for that. Korea is not famous for steak, but nonetheless we are going to eat nice steak that Seoul has to offer. 3 days ago, I got a call from my hospital saying that I am now developing osteoporosis, which is quite new to me. I thought I am healthy, but suddenly they called me on my phone and told me that I need to come see them. I don't think my osteoporosis is that severe enough, so I'm not going to visit their clinic. They just find that out during my annual physical checkup. In Korea, annual physical checkup is free for employees. Company pays for all the expenses, so that's why you need to come and work in Korea. Almost everything is free. So let's find out what the osteoporosis is. This one was generated by Gemini after referring to 15 websites. See the 3 icons plus 12. Osteoporosis is a disease characterized by weak, brittle bones, often with no symptoms until a fracture occurs. Okay, I have no symptoms. It occurs when bone remodeling fails, leading to lost bone density. Key risks include aging. I'm 58 years old, almost. Leading to lost bone density, aging, menopause. I'm a male, so that applies to my women. And family history. My father had to insert or support her thigh bone with some metal tube. He's dead already. He died 30 years ago, so I think when we exhume his body from his tomb, there gotta be a metal tube, stainless metal tube in his body. Complications include I suspect I wondered why he has his thigh bone it was weak, osteoporosis, right? It was rotting. It was rotting away, so he had to replace his thigh bone with a metal tube, like 5 centimeters long. And he was of very big physique. He was like 176 centimeters long, or 180 centimeters. I'm 170 centimeters. So he was very strong and tall. In his group, he was born in 1937, but suddenly he developed weak, porous thigh bone osteoporosis. So genetics maybe. Complications include severe pain, height loss, and debilitating hip or spinal fractures. I've lost 1.5 centimeters in my height. What are the symptoms of osteoporosis? Often called a silent disease, osteoporosis typically presents no symptoms until a bone breaks. However, as the disease progresses, it can cause fractures, loss of height, stooped posture, back pain, shortness of breath. Fractures, often in the hip, spine, or wrist, sometimes caused by minor falls or simple actions like bending over. Wow, bending over and you fracture your hip. They said I have osteoporosis in my pelvis, so obviously hip. I'm worried a little bit. Loss of height, getting shorter over time. I've lost 1.5 centimeters in my height so far. I noticed that I began to lose my height in my early 40s or mid 40s. Stooped posture, developing a hunched back kyphosis due to compression fractures in the spine. Back pain caused by fractured or collapsed vertebrae. Shortness of breath, vertebrae. Shortness of breath due to smaller lung capacity from compressed spinal discs. I have no symptoms of such that except loss of height. How does osteoporosis affect the body? Osteoporosis, which means porous bone, causes the microscopic honeycombed structure of healthy bone to become porous, thin, and fragile. This loss of bone density and strength means the skeleton cannot withstand normal stresses, making it highly susceptible to fractures. Stages of osteoporosis. While often described by severity, the progression generally follows these phases. Normal bone, healthy, dense bone structure. Osteopenia, low bone mass. Bone density is lower than normal, but not yet in the danger zone for fractures. Osteoporosis, bone density is significantly low, causing structural issues. Wow. So I think I'm on the stage 2 or 3 between osteopenia and osteoporosis. I think osteoporosis is there. It's mainly because I just had a poor diet. Severe osteoporosis, bone density is very low, and one or more fragility fractures have already occurred. Now, not with me. Risk factors for osteoporosis: sex. Women are much more likely to develop it, particularly after menopause, due to decreased estrogen. Age. Risk increases as you get older. Body frame. Small, thin individuals are at higher risk, really. Genetics. A family history of osteoporosis, especially a parent who fractured a hip, increases risk. Lifestyle, lack of exercise, smoking, and poor diet, low calcium, vitamin D. Yeah, I'm guilty about that. As I live alone in Seoul, away from my family, I gotta be on a much better diet, but I mainly consume rice, of course, steamed rice, kimchi, sometimes miso soup, fermented miso soup, and most of other times nuts, sometimes some fruits, jujube or jujube especially, but nothing much, right? That's the diet I consume for my dinner. During the lunch hours, for my lunch, I go out with my colleagues. So it's the lunch, it's the restaurant food. In Korea, I suspect many restaurants use MSG or artificial food enhancer, right? Food flavor enhancer to be exact. So that's not a good food. Medical conditions and medications. Long-term use of steroids or cancer treatments. I used a lot of steroids when I was young because I had to treat my skin problems, eczema, or atopic dermatitis. Complications of osteoporosis: broken bones, chronic pain, disability and loss of independence, mortality. Broken bones, primarily in the hip, spine, and wrist. Chronic pain, long-lasting pain from broken bones, particularly vertebral fractures. Disability and loss of independence. Hip fractures often lead to reduced mobility and require long-term care. Mortality. Hip fractures in the elderly have a high 1-year mortality rate. Wow, that's severe, right? When you fracture your hip bones and you are very old, you have a higher 24% or higher 1-year mortality rate. So you die within a year, right? That's severe. 25% or 30% people, they just die from fractured hip bones. For diagnosis, a bone density test is typically recommended for women over 65 or those with high risk factors. Treatment: which can prevent further loss, often includes a diet high in calcium and vitamin D, regular exercise, and medication. Treatment which can prevent further loss often includes a diet high in calcium and vitamin D, regular exercise, and medication. I'm guilty of not doing enough exercise. I used to do a lot of jogging, and then from 2013 I just did a lot of walking. Currently I walk more than 1 hour, right? Or I walk more than 4 kilometers, especially when I finish work, daily work, and go back home. I just walk, right? I walk from KT Bangbae Tower or KT Socho to the express bus terminal station or Dongjak station. That covers about 4 kilometers. Then I ride subway to my home in Oryudong station. So basically I walk 4 kilometers more compared to other people, to other Korean citizens. And when I walk, I do the anti-cancer touch walking or power walking. You just swing your arms left and right and lift your toes much more than normal. And you breathe in twice and you exhale once. Just like that. And you walk. You can check out my video on YouTube by searching for anti-cancer touch walk or power walk or 항암 산책 or a Guolin walking or Guolin Qigong walk, or simply you can just look up all of my videos on YouTube, right? By just tapping or clicking on my name, my ID, right? Thanks, Park. Well, that's it. I think I'm developing osteoporosis, but I would be okay. I'm just a healthy person. I am always lucky, and always I feel always the universe always supports me, gives me strength, awards me with a lot of cash, prosperity, happiness, and love and care. So I would be okay. But from now on, I will just consume a lot of calcium and vitamin D so that I could prevent further loss. There aren't any special words or expressions that I want to remember. So I'm going to finish this reading English article here. My company picnic starts at 10, so I still have 1 more hour to go. I'm just sitting on a bench in a park in Seongsu-dong. I think this is like a shoe modeling park, because Seongsu was known for shoemaking, right? Manually they make shoes, not in a factory but in a small mom and pop shop. So this park is dedicated for people making shoes so that they could come out and relax and go back to their daily chores. Thanks for listening and have a great Friday. Bye bye.